Hello, good morning. My name is Adam Kaleciński. I'm the owner of our clinic, Wrocław, Poland. And let's talk today about secondary breast augmentation or implant exchange or implant replacement. It's quite common that everybody says that this is quite simple surgery, but that's not true. It depends on the type of patients, on the type of implants. Sometimes we have difficulties when we should do breast augmentation, breast implant exchange with resection of fibrous tissue and changing into smaller breast implants. This surgery is related to, of course, breast uplift. We have to trim the skin envelope in such cases. Implant replacement at the moment is quite common. Why? Because of the complications after breast augmentation. Now recommendation is to exchange implants every 10 years due to capsular contracture, due to other complications. Everyone needs to know, every patient needs to know that this is not for good. I mean, the implants are not for good. They have to be changed every a few years. This is not only because a capsular contracture, but also due to so-called lymphoma related to implants, quite malignant disease and quite serious disease, which is lately discovered. Pain in general, we can say that this is very individual phenomenon, and it depends on patients mostly, not necessarily on the type of surgery. Sometimes we have patients with threshold very low, sometimes we have patients with pain threshold very high, and sometimes we need to use quite strong painkillers. Sometimes these painkillers are quite weak, or there are patients, they don't want painkillers at all.